is it safe to eat in acute pancreatitis? Well, it depends on the severity. During acute pancreatitis, enzymes, toxins, and cytokines can result in organ failure due to metabolic dysregulation, leading to hypermetabolism, making nutritional support important. Traditionally, diet was held in pancreatitis to avoid pain and relapse. However, a study demonstrated that fasting can actually lead to a high risk of sepsis and organ failure. The PADI trial from Spain compared immediate to conventional oral refeeding in mild and moderate pancreatitis. Immediate refeeding consisted of a low-fat, solid diet. Upon admission, as long as bowel sounds were present, there was no nausea or vomiting or an ileus. Whereas the conventional group followed the idea of pancreatic rest, where diet was reintroduced after fasting, then progressed to clear liquids and finally a low-fat diet once there was a lack of abdominal pain, presence of peristalsis, and improvement of labs. The authors found that immediate feeding had a shorter length of stay. Additionally, these patients actually required less opioids and analgesics. Interestingly, 99% of these patients were able to tolerate their diet better than those in the conventional group, where 21% of these patients had diet intolerance. Lastly, the immediate oral refeeding group had lower complication rates and progression of their acute pancreatitis. In this study, patients with mild to moderate pancreatitis had better outcomes with immediate introduction of their diet rather than a stepwise approach. In fact, the results of this study is supported by the 2024 American College of Gastroenterology guidelines on acute pancreatitis.